that. Yeah.
I'm Dr. Byron Calhoun. I do maternal fetal medicine, which is high-risk obstetrics. Most recently in Rockford, Illinois. I am board certified both in obstetrics and gynecology generally, and then a subspecialty in maternal fetal medicine. So my specialty deals exclusively with high-risk pregnancies, and I see quite frequently a number of these babies who are miscarried spontaneously, but not induced as induced abortions. We're asked to come here today to discuss two babies who were delivered prematurely, and to discuss and describe what we find. This is a baby who looks like it was delivered at approximately 14 weeks of gestational age from last menstrual period. We know this by the size of the baby and the features that we see. You can see that this baby has a normal appearing face and fused eyes, which are consistent with this. The ears look somewhat low placed, but that's because the baby's only 14 to approximately 15 weeks in gestational age. The feet and hands, as you can see, if you get a look at them, have 5 fingers and toes and nice delicate creases in them. The limbs are normal, and the baby's back appears normal also. There is some skin slippage, as you see this, on the side of the head here, and also perhaps a little bit on the side of the head on this side a little bit. The cord has been cut approximately 10 centimeters here and looks normal. The abdomen appears normal in this baby. Now you notice that the baby does not look the same everywhere. There are some dark areas and there are some lighter areas here. You notice on the bottom of the buttocks of the baby. That is consistent most likely with a prostaglandin type of an abortion, which cause what we call tetanic or very hard type of contractions. And these bruise the baby significantly, and that's why you see this darkened or bruised appearing features on this particular baby. Most of these babies actually are born alive. This baby may not have because of the bruising and some of the skin slippage. This could have been consistent with this baby dying prior to birth. However, again, as we note, there are no defects in this baby. This is not a baby who was aborted. It does not appear for genetic or structural abnormalities just by visual inspection. This is our second baby that we see. As you can note, by comparison of these babies, it's important to note this, that side by side, there is a significant amount of difference here. This baby is more consistent with an 18 to 20 week gestation. And we know this by the size, from the bottom to the head. We notice with the more complex and more refinement of the features. The ears, if you notice, look more normal in placement. The eyes still are fused, which is consistent with this gestational age. The face is more delicately formed. You can actually get a better impression that this baby was actually more well preserved and probably was born alive. There's much less bruising in the face. There is still this darkness that we saw previously, and we noted. If you notice, the umbilical cord is cut much shorter, approximately 2 centimeters from the insertion site, and the genitalia in this baby appear female. And it looks like that we can actually tell that, and that really gives us the indication that this is an older baby, sometimes very difficult before 16 or 17 weeks to see sex. This baby appeared male. We see the beautiful hands and fingers of this baby. We can see the delicate palmar creases on the child. We see the feet and the hands and the toes are very well formed. If we turn the baby over, the baby's back has no defects. It appears very normal with that bruising that we noticed previously. And there does not appear to be any visual abnormalities to this baby either. Inside the lips, there's no palatal defects or cleft lip or palate. And again, this baby was probably born alive just by the way the baby appears and by the way in which the modeling is. And there's less than there is on this baby. There's no skin slippage or anything of that nature. And again, more like 18 to 20 weeks, and this baby more like 14 to 15 weeks. Look at babies who died by saline. They actually have more of a burned appearance and actually appear red, and they actually have significant amounts of skin slippage. It's like the skin is being peeled off the babies, and these babies do not demonstrate any of that. So it's unlikely that that has been done. Also, over the last 10 to 15 years, very few saline abortions have been done because of the risks to the mother. There's significant mortality rates with the fluid shifts with the saline itself. These look more like, again, the prostaglandins or the injections that are done with that, and that's why you see the bruising on the babies, the modeling.
Could you comment also on what you were telling me a few moments ago about the likelihood of how long ago these babies died?
Well, looking at the preservation of the babies and how nicely preserved the babies are, even in formalin or the formaldehyde, you'll see significant degradation or significant deterioration in the babies and their skin and their features. These babies are actually very well preserved, so they've been in formalin, nicely preserved, but I also think they haven't been in there that long because there's not much deterioration, especially in this baby, at all compared to this baby. So my guess is somewhere in the last 5 maybe years or so, because they're very well preserved. But you will get deterioration over time, even in formalin. So these babies look relatively recent. They don't look like they're 20 years old. These are new.
Could you give then, just for the as an overview for the viewers, again, a review of the different types of abortion, particularly at this gestational age?
Well, there's really 2 types of abortions. There's the surgical abortions, which are done with instruments where you would place certain things, say laminaria or things to dilate the cervix, send the patients home for overnight, generally to 24 hours, bring them back then and do a forcible dilatation with instruments through the cervix into the uterus, and then do a cutting procedure or dismember the babies, essentially is what you do, and pull the babies out by pieces. Now these babies are very well preserved, so these babies would have been, I would consider, medical type abortions. Medical abortions are generally done with what are called prostaglandins. Prostaglandins are naturally occurring substances that aid in labor when moms are at term with the aid of the natural hormones. There are powerful prostaglandins that cause, as I describe them, tetanic, very, very strong contractions, and work very, very well early on in gestation, as well as can be used later in gestation for ripening. But these are the kind that are very powerful, that are placed either vaginally, or they can be given intramuscularly, or they can be taken orally, and these cause rapid contractions, and given every 2 to 4 hours, will then expel the baby, and just like a labor, essentially, and have very hard contractions, which is why you get this bruising in these babies, because of these powerful contractions in the delicate skin in a premature baby. So those are basically the 2 types: the surgical with instruments and dilation, and basically taking the babies apart, and then the medical where the babies are born intact. Now the risk, obviously, to a medical abortion for the abortionist is that these babies are born alive often, and I think that's what this baby was. And they can live for several minutes to hours, even at this gestational age, without being able to breathe. They have a heartbeat for many, many minutes to hours.